Semaglutide shortage ends as FDA sets deadline for compounders. What does this mean for you? Good question. So this already happened to tirzepatide, which is the other medication known as Mounjaro or Zepbound. It's now happening to semaglutide, known as Wegovy or Ozempic. All this is saying is that the reason these compounding pharmacies were able to make it in the first place was because the pharmaceutical companies were not producing enough for the demands. So they were allowing these smaller mom and pop compounding pharmacies to make enough to help the average person get what they needed. Now that the shortage no longer exists, as per the FDA, they're going to stop these compounding pharmacies from being able to make these medications, meaning you're going to have to get the brand name. Also meaning it's going to cost you a heck of a lot more. So these medications are now going to go from like $300 to $1,500 a month, unless you can get it covered by insurance. So who can get it covered by insurance? Well, that depends on your insurance plan. Most plans won't cover it for weight loss. A lot of them will cover it for diabetes. Some will cover it for something in the middle, meaning if you're pre-diabetic and overweight, then maybe you can get it prescribed to you. I have seen it covered sometimes in patients who are obese who don't have any resemblance of diabetes or pre-diabetes. So overall, I think it's good that the pharmaceutical companies are making enough to meet demands. I do think though that the average person might get caught having to pay a lot more for these medications. So likely you probably only have weeks or maybe a month or two to get the compounded version of these medications for a lot less expensive than what you'd have to pay once this all goes into effect. If you are someone who's trying to lose weight, who's looking at one of these medications, now is the time to jump on them. Give us a call, we'll help you out.